Communication in hospitals has been failing the deaf community for years. Historically speaking, medical interpreting just does not provide adequate or efficient communication for deaf patients and their families. Medical interpreting requires a complete fluency in American Sign Language, or ASL, but it also requires a complete fluency in medical terminology. You have to be able to translate equipment, procedures, diagnoses, treatment, and all sorts of other medical scenarios, as well as the ordinary conversations that comes with interpreting. This is no light task, not to mention that there's a huge privacy intrusion when a patient has to convey very serious and important issues to a doctor through a stranger because they can't communicate directly with their doctor. There really is no easy solution, but there's one thing that all medical professionals can do, and that's try. Knowing just a few signs could be the difference between a deaf patient getting help and not getting help. I've created this video to teach you 15 important phrases translated into American Sign Language that you might find yourself needing in a hospital setting in order to give a deaf patient the help that they need. So the first sign is, I need help. And so this is the sign for help, so if you see this or this, that just means they need help. And they could direct it, they could say, please, you help me, or you help her. They'll push it towards whoever needs the help, but help. Second sign is doctor or nurse, so that's doctor or nurse. So you'd say, I'm your doctor, or I'm your nurse. The third sign is sick. So I'm sick, or they are sick. The fourth set of signs is family. So this is the general sign for family, and then the immediate family members you might need to know is mother, father, brother, sister, daughter, son. So that's all your immediate family that you might need. The fifth sign is fever. So there's two signs for fever. You can either do it like this or fever. The sixth sign is numbers. It's 1 through 10. So if you have the pain scale that goes from 1 to 10 with the happy faces and the sad faces, if you show that to them, the responses that you might get for where is your pain on the scale of 1 to 10 are the numbers. So the numbers are 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. The next sign is pain. So this is the sign for pain. And then if you need to know where they're experiencing pain, you would say pain where. And then their response is they will do the pain sign, or they will point to the part of their body that they're experiencing. So this is a headache, a stomach ache, maybe if they're experiencing shoulder pain, they just do the pain wherever they're feeling it. If you ask them maybe how often do you experience this, then the responses you will get are things like always, sometimes, once in a while, and never. So the next phrase is to ask them how long they've been experiencing pain. So what you would sign is you'd say the pain has been continuing for what? And so that's pain continuing what? And then the answers you might get is this is days, weeks, months, or years. And then a number would probably follow that to say like how many days, months, weeks, or years. The 10th sign is medicine. So maybe I need to give you medicine, or you need medicine. This is a sign for medicine. The next sign is blood. So if it's not obvious, if that they're bleeding, like bleeding from their head, bleeding from their shoulder, you might see blood. The 12th sign is relax and breathe. So relax, relax, and breathe. Take a breath. The next sign is stay. So please stay where you are, or please stay in your bed. Stay. The 14th sign is bathroom. They're going to need to know where it is, so you can say like there's the bathroom and point them in the right direction, bathroom, or they might ask you bathroom is where. So if you see that, you know what they need. The last phrase is I'm going to find you an interpreter. So interpreter, I will find. And so let them know that you're going to get them the communication they need. So there's 15 signs that you could find yourself in need of if you work in a hospital or if you find yourself often in medical situations. It's really important that you learn things like this. It really could save a life. So thanks for watching.